This is Dr. Kaan of the ACL Academy, and today we are going to talk about the many ways to work on your knee bending motion, your knee flexion motion. Before I get into that, guys, if you've been following the page, following along with us, please like the video, subscribe to the channel, share with a friend, spread the word. So, bending, super, super important, one of the foundations after ACL surgery. So important to really work on that motion early on, get it going, because we want to normalize your range of motion, right? And we want it to be not good enough. We want it to be perfect. We want it to be symmetric to the other leg. So right after surgery, you guys will hear me talk about, most importantly, when it's swelling down, pain down, we want to get full straightening motion back, right? That's key. You got to get that quad muscle fired up. But flexion or bending is also very, very, very important. So we do start this early on. Now, it also depends on your surgery itself. If you just had ACL surgery alone, there's no restrictions to bending, and you really can start to bend right away. If you had a meniscus repair, a complex meniscus repair, your surgeon may limit your motion. So that is something that you need to know and talk to your surgeon about. However, if there's no restrictions, we can start bending. There are many, many ways to do it. I'm going to kind of walk you through how I do it. In the beginning of the process, we do a lot of it in a non-weight bearing, so where your leg not on the floor. And as your bending gets better and better, and you're able to get deeper and deeper in the ranges, we start doing a lot more weight-bearing flexion, right? So we're really trying to kind of throw our body weight into those flexion ranges. So I'm going to kind of walk you through some of my favorites. Some of the early stage ones, middle stage ones, and then end stage ones, is we're really trying to get deep in the motion here. Super important. We start right away. And my key, what I explain to everybody, every one of my clients, in order really to get flexion range back, really to get that bending back, it has to be very, very consistent. And has to be at a higher volume. So that means every single day you should be doing specific bending exercise. You should have a bending program, which may consist of 3, 4, or 5 exercises a day, anywhere from 10 to 20, 25 minutes of work per day, as long as, and it really depends on how your range is coming back. For some people, it'll come back quicker than others. Some people who are struggling, you may need a little bit more work, you may need a little bit more structure, but you cannot depend on your physical therapist to just crank and stretch your knee once or twice a week and think it's going to come back. This has to be an everyday routine, and the success and the magic lies in you putting in the work, you doing it daily, consistently, and at the high volume, the prescribed volume, with a very structured, clear plan. So let's get into it a little bit. So in the beginning, right, we're going to talk about some non-weight bearing type stuff, where what I like to do, a very easy setup, comfortable position. You could sit with your back against a wall. So I have a table here, but you could literally post up against a wall or your bedroom. And let's say this is the leg here. You can use your hands, very easy, to provide some active assisted motion. So usually I grab underneath my thigh here, and you can pull up on the knee and go to that barrier. So we're not trying to necessarily push past the pain barrier. We want to go right up to it. So pain levels at 2, 3, even 4 out of 10 at times is okay, but we don't want to like crank on the knee. So in the beginning, I like to do 2 ways of this type of stretch. One is more of a static hold. So I will come up to that restriction. Let's say it's a 2, 3 out of 10. I will hold here and for about a 60-second contraction. And then once I get to about 60 seconds, I will slowly start to release it. After that static hold, I will try ranging. So we will do coming up to that point, that barrier that I just got up to, and then back. So I may do 10 of these, nice and easy, take it up as far as I can, and then back. So I'll do 10 reps like this. After I'm done with my 10 reps, what I'll then do is go to that same point barrier, maybe a little further past it, and try again for a 60-second hold. and then repeat the 10 reps. So this is a gentle heel slide. You could use hand assisted. You could also do pillowcase or towel assisted, where you're wrapping and pulling from here. Either way, whatever you're comfortable with, both positions work. They're easy to do. Okay, so this is just a seated heel slide and assisted, right? So we are using our hands, but I'm also encouraging you to use your leg muscles, right? So you want to pull with your leg, but also help out your hands. Next, we do a reverse heel slide. So with our legs elevated. So here's what I would do: is I go laying on the floor, feet against the wall here, right? So we will come up. You can get some assistance to put your leg up there. You want to slide as close to the wall as possible, okay? And then here's what we'll do is use your hands and slowly, gently pull in this flexion position. So again, I'm going to go to that barrier where I feel comfortable. I have the wall for support here. We're going to hold for about 60 seconds at that end range. And once I get to that 60 seconds, I'm going to repeat what I did before, which is basically moving out of it into full extension and then pulling into full flexion. And I'm going to do my reps that way. Use my hands for assist. You can use a pillowcase behind the knee to pull and then push. You'll do your 10 reps. And then once you do your 10 reps, you're going to do, again, another hold at the deepest part of the range where you feel the barrier for 60 seconds, and then repeat. So that's what I do like to do in the beginning. It's a good way to get the knee moving and going. It's your hands are in front of you, your face is in front of you, so it's a less vulnerable position. You have all the control there. Okay? Next, okay, as you get further in the range and we want to start maybe doing a little bit more weight-bearing type stuff, what I like to do is a standing version. So with this, I do like to use a little towel or pillow for some control here and some comfort. So I'll take a towel, I'll roll it all the way up, and this will just give me kind of like a cylinder. You could use a towel, you could use a sweatshirt, you could use it even like a small pillow even, right? So we want to get something similar to this. And then what I'll tell you is to just grab a chair. So you can grab any type of kitchen chair or whatever it may be, and your leg is going to go right on the chair, okay? This pillow is going to come underneath the knee, so almost like the armpit of the knee here. And the reason we provide this here, it provides some traction on the knee joint. It can be a little bit more comfortable as we get deeper in the range. So this is the starting position. You're going to hold the towel in place, and then what I'm going to do is kind of drive over it, okay? And again, we could do this as a static hold for about 60 seconds. Pillowcase here providing a little bit of comfort, and then come out once the 60 seconds is up. And then I could kind of drive deeper and deeper into the range. And I could also do this as a mobilization where I'm holding maybe 1 or 2 seconds. So I could do my 60-second hold where I'm kind of putting my body weight into it. The towel's here. I'm holding this position. And then once my static hold is up, I can come out and then work my way back in. Okay, so again, we're doing more of a mobilization as opposed to the hold here. So that's one version of a standing. Next, I like to do a deep assisted squat. So you can use a chair again for this. You could also use a dining room table. We're going to do hands on the chair. And what we're going to do is we're going to try to kind of sit into a little bit of a squat here. We're going to take up as much range as we can, and we're going to do this as a hold. We may hold up to 30 seconds, 60 seconds, and then come out. And then we also may do this as more of a mobilization where you're sitting here for about 3 seconds or so, and then coming out of the range as well. So that would be another version of a standing weight-bearing mid-stage flexion range of motion. Then the two more aggressive ones that I like to do is getting into kneeling. So with this, you can do this on a floor, a little easier to do on a softer surface. Here I also like to use a pillowcase, provide a little traction, a little comfort, and we're going to do this as a mobilization. So we're going to sit here again for about 60 seconds or so, and then come out of it. Once my 60 seconds is up, I may do this as more of a mobilization where I'm holding 1, 2, 3, and then coming out. Holding 1, 2, 3, coming out. As you get better and more comfortable with that, which may take some time, you will go to a half kneel. So my other leg will come up, and now all my weight will be going on the surgical leg. So this gets me into a real deep range here, and I'm coming out. Here, as before, you can do a static hold, 30 to 60 seconds, and then you would do more of a mobilization where you're doing 2-3 seconds and then back up. 2-3 seconds and then back up. Once you get comfortable, you may not need the towel, and then you're going to sit right onto the knee and then push out of it. Sit right onto the knee and then push out of it. That is more on the aggressive end. Lastly, I also like to do a deep weighted lunge. So I'm going to show you on the table so you can actually see how I'm doing this. So let's say my right leg is a surgical leg here. Okay, we're going to come into a lunge position here and then come out of it. So you're going to lunge into the knee. My toes come up. I really try to push forward and then come out. So this would be a very deep, aggressive mobilization, and you wouldn't necessarily be doing this until the later stages where you really feel comfortable, but all my body weight is coming onto that front leg. I'm coming out onto my toes, so I'm really driving the knee forward here. So I went into a whole bunch of flexion exercises. You can do some of these, you can mix and match, you can do all of these. It's important that you do the ones for where you are in the stage of your care. So you won't be doing a kneeling or a lunge unless you're prepared to do it. Right, the knee is ready, you have the range to do it. You may start with a lot of the beginning ones that I went over, and then as you get better and better with the range, more comfortable with it, you're going to get into more deep weighted flexion ranges. The most important and the key to this stuff is consistency. So you have to be doing it daily. You have to have some structure, and the onus will fall on you. Not depending on anybody, your physio, your trainer, your strength coach, whoever it may be, to be moving your knee for you. Active motion is best. And again, high volume, super consistent, daily. So work with somebody who can prescribe these things for you, can let you know what stage you're at. You shouldn't mix and match or play with any of these until you talk to a provider or an expert that can guide you as to how much, how often that you should be doing this and what particular exercise. But those are some of my go-tos. Those are the exact ones that I prescribe to my clients, and we see a lot of success. But as I said, the success lies in you putting in the work, being consistent, staying on top of it, doing it daily. Guys, I hope you found some value in this. If you have, please like the video, comment below with any questions, subscribe to the channel, please share with a friend. This is Dr. Kaan signing off, and I'll see you next time here at the ACL Academy.